So welcome to Psycho Psych Incubator, Eminent Psychotherapist Revealed. We are pleased tonight to have Dr. Kenneth Critchfield, who I've known for about 20 years now.
Oh
And
boy.
tonight, I feel this is going to be a special event because we're instead of doing our regular discussion, we're going to do a psychotherapist face to face, which is Ken and me really engaging in some uh, dialogue about Ken and about his work with Dr. Lorna Benjamin, who's been tremendously influential in his work. So
Mhm.
Ken is a licensed clinical psychologist and psychotherapy researcher. He received his doctoral degree in 2002 from University of Utah. He has worked closely with Dr. Lorna Benjamin, as most of you who have followed him know, who is the creator of Interpersonal Reconstructive Psychotherapy. They have a new book that has been recently published, which I had the opportunity to review, which is really excellent. Ken will talk more about that. Um, he's very interested in treating adults that have severe trauma and chronic problems that are often comorbid presentations with comorbid clinical disorders and personality disorders, which are obviously very challenging patients to treat. Ken is a tenured associate professor now in clinical psychology at Furkhoff Graduate School of Psychology at Yeshiva University, as well as the director of the IRT Institute. So, Ken, thank you so much for joining us tonight and your willingness to share your expertise with us. Um, I'd like to actually start out our discussion by having you tell us what it is that brought you into this field, because it's such an interesting thing we do. We
It's
sit
a
with
crazy field
people,
of ours.
we sit with people in pain sometimes all day long, and I know you're also a clinician and a researcher, so you also have that other perspective, which I think is going to be fascinating to explore these two kind of parts of you, the clinician part and the researcher part, and also the academic. So
Yes.
how did you get here?
And maybe the musician as well.
And a musician, yes.
Uh, it, there's so many entry points to answer a question like that. The thing that comes to mind right now is I remember in, I don't know, elementary school or middle school or something, they were giving us those exams, those tests of vocational interest, aptitude. And I felt offended by the feedback I got, which is I was interested in um, things and ideas, and the people were last as a set of categories. And I was on track to be, jewelry maker or something like this.
I'm
And
sure.
yeah, and I mean, I do like science. I do like the material world and taking things apart and seeing how they work. I was the kid you should probably not leave alone with too many household appliances, or I'd be messing with them and seeing if I could put them back together again. And sometimes I could, but there was something about getting that feedback that young me said, like, well, the ideas that I care the most about, yes, I care about ideas, but the ideas that I care about are the ideas about people. And so I'm kind of holding this idea of what it is to be alive and human in my mind as a kid somewhere. I think I understand that better in retrospect now that I've been a clinician a while and started to get enough space for my own family of origin that I can go back and say, oh no, here's probably why really I'm
Well,
a
can
therapist.
I just interrupt you a minute and say, like,
Yeah.
I know you grew up in Utah and your
Mhm.
family are Mormon, right? Is that true?
Sort of, but not quite. There's a prototype that applies, and my family was absolutely not that prototype. It, probably the better prototype is to say my parents were Vietnam era hippies who were pretty disillusioned and probably
Huh.
could have settled in the rural areas of California, but they settled in the rural areas of Utah instead. And proceeded to have kind of a family rift about religion and meaning in life, but not in any sophisticated way, really. I'm first generation into all this weird educational stuff we do.
Can you
So
turn your volume up a little bit? Your volume is
is it not good?
not good.
See what I can do. I'm pushing a button that's
That's
supposed to
better.
make it go up.
Okay, we
Okay.
got it now. Okay, good. Yeah,
But
you were fading a little bit when you were talking about your family of origin. I don't know if there's
who doesn't?
I don't know if there are any unconscious issues that are at play there or not, but
Yes. Well, so it's so I'm suffering along as you do in a family system that is at war with itself, and I'm just trying to figure out who I was as a kid. I exit that system, run off to college, and think that I'm interested in computer science, and I probably would have a lot more money now had I stayed on my initial interest of artificial intelligence and kind of straight mathematics and some of this stuff.
oh wow. Huh, I
But
didn't know that about you. That's interesting.
yeah, I've got all this kind of like math science
Huh.
fun and games in my head somewhere.
Oh, interesting.
Yeah, it's probably why I can't let go of the research side of me. I
Yeah.
love a good spreadsheet.
Uh-huh. Uh-huh.
But um, I mean, at the time, I was sort of disillusioned with what I was learning and realizing that just because you're good at something doesn't mean you have to do it. And I found that I was much more interested in a psychology class, and I started thinking, well, why mess around with artificial intelligence if there's so many like actual organic evolved intelligences here to understand? So
So
I
do
got
you know
myself
about
interested in psychology.
so do you know about the concept of dharma, which I don't know much about, but do you know that concept, dharma?
Well, yes, from a few different perspectives. What's your perspective?
So my idea is that we all have something we're meant to do. And
Mm,
if so you say your parents are physicians, they say, Ken, you really got to go to medical school. You got to do it, and they pressure you, you go to medical school, and you really wanted to be a researcher and a psychologist and a clinician, and you didn't do it, you would never really be fulfilled. So Dharma is sort of now this is just my very
no, no, I'm
elementary understanding of the concept, but it stuck with me because I think one of the questions I always ask people is, do you think that therapists are born or can we make them? But we can talk about that later. But the Dharma thing, do you feel like this is your Dharma to be like you feel like you followed your path?
I do, but I don't. At this point in my story, I had not fully recognized that yet.
Okay,
But yes, I think the answer is yes.
cool.
Um, I have a cheeky answer to the if therapists are born or made. It's sort of like we're
Yeah.
sort of, I think a fair number of us are like wounded into the field,
No, I think
but
that
only partially, like an
yeah,
inoculation, enough that you
yeah,
can recover and help other people.
yeah,
But
yeah.
for me, I I have I was raised in rural Utah, and I have a lot of fluency with Mormonism, including I was a Mormon missionary. I was knocking on people's doors. And,
Really? Oh, you did your mission.
yeah, in the north of England, Manchester,
Wow.
Liverpool. Um, I would have loved to have lived that couple of years over again, able to go to concerts rather than not. But it was in
Oh, see, I
pop
didn't know
and
that
music
about you,
scene
that you
back
actually
then.
did the mission.
Yeah, no, I was in it to win it, and believe a true believer. And I worry about now that I'm no longer part of that. I think part of what interests me in psychology is the fact that I was in touch with a lot of people from a lot of places talking about a lot of stuff while I was on that mission. I got very interested in people and how they think and feel and believe. And I think that I also became interested as I left that church over time in how much I believed in something very fully and then came to another place where I believe and see things very differently now. And
Interesting.
just I think there's a certain amount of checking myself that I get into even now about
Mm.
my beliefs and how people work and how psychotherapy works and how science works that I have to kind of check and say, well, Ken, are you channeling that young evangelical type again, or are you really sticking close to science and kind
Yeah,
of some kind of humility about your epistemology?
yeah,
And
yeah. Yeah,
mhm.
that's really interesting.
Well,
So
so
I know that you've devoted a lot of your work to interpersonal reconstructive therapy, which we're going to talk more about. But
yeah,
before we get into talking about the specifics of your work, um, I know that you met Lorna
mm,
Benjamin, and I I
well,
know Lorna Benjamin.
this is where the Dharma thing comes in. Actually, is is I was doing all this stuff about artificial intelligence and psychology. This was at the University of Utah.
Yeah.
She's on faculty there. And somehow or another, I make my way into, I was, one of the advanced undergraduates who was somehow allowed to be in the grad
Yeah.
class in
Yeah.
psychopathology, get my feet wet, see what that might be like. And she was teaching that class.
Wow.
And that was my first exposure to her or her ideas. And I was just floored about how much she had pulled together with the structural analysis of social behavior, the SASB model. She was contextualizing the DSM, all of psychopathology, including the personality disorders,
The
of
gift of
course.
love.
And putting it into interpersonal terms
Yeah.
that mapped for me in terms of like, I think at that point I thought to myself, people don't make a lot of sense. We're not particularly good at being rational animals unless we try really hard. And but there's an emotional logic to us that seems to be kind of for individuals. This is the language I had at the time, and this kind of fuzzy concept of emotional logic that different people have got mapped into Lorna's system very readily as like, oh, I think there's something I really need to follow here. And that opened up a bunch of doors for me in terms of knowing who she was, but then just realizing, oh, I really want to learn how to understand people, whether that means being a psychotherapist or a psychologist. I wasn't sure where it would head at that time. So I applied to grad school. I do not land with Lorna Benjamin in grad school, but I land with her colleague at the time, Bill Henry, who is also working with SASB and psychotherapy. He was a student of Hans Strupp. And so we're in the psychodynamic and interpersonal realm.
Mm-hmm. Mm-hmm.
And I'm thinking in terms of common factors and interpersonal features and personality. And Lorna is here teaching some of my classes, and I am increasingly in her orbit. And over time, I'm thinking, oh, I understand this set of therapeutic ideas and principles well enough, and I have enough under my belt as a psychotherapy researcher that I think I can do a fair or a fairer test of what she offers. So instead of like the traditional RCT horse race, let's see which manualized version works. I was pretty sure, like, if you, I still am basically feeling this way. If you put any therapy up against a no treatment control condition, it's going to do fine. And if you put any two therapies up against each other, they'll be about equivalent.
Yes.
And Lorna's model was never about general effects of psychotherapy. She was never interested, I think, in does therapy work. And I never was interested in that question. Like you had me at hello with does therapy work. For me, it was how does therapy work, and that's where I interface with her and get a lot of my cueing from her. Is the question is about how do humans work, and from that point of view, how can you do things to help shape the patterns and trajectories that they're on that are causing problems? And so that's a harder set of research questions to try and
untangle
and measure and untangle. And so I was on a track to say like, oh, I think I can do that. And I went away on internship, went away on postdoc, but came back for a second postdoc to work with her at Utah. And that's when I think I had the a further deepening of this kind of Dharma concept, which is knowing that I love these ideas and can work with them, but realizing that up to about that point, psychotherapy seemed like a good thing to be doing, but outcomes felt exactly like they're listed in the in our scientific literature. It's like there's a sort of a probability field, and a certain number of people are going to be benefiting, and a certain number of people a little bit, and another bunch of people will maybe even get a little worse.
Yes.
But predicting that is hard to do. Just that it's going to be in these about ratios. And therapy kind of felt like a probability field to me. You do your best and you optimize the regression equation in the sky, and you see what you can do. But with sort of co-supervising and being in orbit with Lorna, over time I started to say, oh, this is feeling causal. Like I know that when I do this, this happens in response, or when a patient is saying or doing this, it makes sense in light of this context. And I found that I was giving parallel feedback to our supervisees with Lorna that mapped onto what she would also recommend. And it wasn't always straightforward or intuitive, but following these principles, it was like, oh, there's an emotional logic, and there's a way to map and I think scientifically test how that emotional logic works. And then that comes up with a lot of these important concepts in our field about how to tailor psychotherapy to individuals, how to be responsive in specifically healing ways, and how to understand. Well, this is what I like about the unification movement in terms of integrative psychotherapy. It's the way I think of its meta psychology, and you can correct me if I've got the language wrong, because this is your wheelhouse. But to me, the interface is that being a good psychotherapist is not about knowing your orientations very well and being part of the established culture or canons that we've developed. It's got to center on how do we understand the nature of human nature, and can we meet a
Yes. Yeah.
particular individual and work with the principles that will help them in particular. And if that
Yeah.
happens to overlap with some orientations, if grabbing some techniques is helpful, that's great. But there's a deeper conceptual thing happening.
And I think that's where Lorna Benjamin's brilliance is, because
Yes.
I was privileged and fortunate enough to be introduced to her when I was decades ago. I was working with Ted Milan, and
Ah,
he was very close with Lorna, and he introduced
yes.
me to her, and we actually wound up doing some presentations together, which was just a very profound experience for me. We did, I don't know if you knew this, but we did uh, I Lauren and I did a week at the Cape Cod Institute where we both presented our models. And
Ah,
at one point in that week, we did a demonstration where we both interviewed the same patient, a volunteer
mhm.
from the audience, and it was a fabulous experience. And her her clinical work was so amazing, but her intellect was
Yeah.
just so far beyond anybody I ever ran into, except maybe Ted Milan.
And if I've not seen Lorna and Ted together, but I heard Lorna talk about Ted, and she
Yeah.
was someone whose intellect she deeply respected, and was
Yes.
amazed at how he could apparently speak extemporaneously
Yes.
with references and citations.
Yeah. Yeah. No, I was privileged to be able to hang out with them
Really.
and at dinners and the
Well,
three.
now I want to interview you more than them.
Well, it was just fascinating. The two, probably Ted and Lorna Benjamin, I would say, were the most brilliant minds that I've encountered
Yeah.
in this field. And um, when they were together, and I would sit there with them, and we were interacting about the stuff we're talking about now. Wow, I wish I had recordings of it, but we did this joint interview with this patient, and Lorna was really interesting because she was, as you know, she was a primatologist. She worked with
Hmm.
Harry Harlow
Hmm.
before she got into clinical psychology. And so I presented a case. We were presenting videos at this week, Cape Cod Institute. So she presented a video, I presented a video, and then we did this live demonstration. But I presented this video of this Vietnam submarine commander, and Lorna said to me, Jeffrey, the reason that you're able to work with this guy is because you're an alpha male. And I'm like,
Mm.
what? But from her primate,
Oh yeah, yeah,
and I was like, what are you talking about? I didn't really get it, but it was,
yeah. No, she has always seen us humans as a type of herd animal, an
yeah,
animal, and that very and the way that she frames at least certain aspects of our functioning that relate to psychopathology and clinical
yeah,
problems
yeah. So
is
I didn't
is
know what she,
shared across.
yeah, I didn't know what she was quite I don't know if it was a
Oh,
compliment or a put down at the time, but she said, I
could have been
couldn't
both.
work with this guy, but because you're alpha, I'm like,
Yeah.
but that's always
You,
stuck with me, her
it,
comments, because we commented about one another's process, and what
uh,
an experience.
I bet. There's another thing. I've been teaching a personality assessment class here in this ID program, and um, I make sure to pass through the MCMI and talk about Ted's theory. And there's a piece of it this beautiful graph I put up, and every time I do it, I realize this overlaps with something else Lorna was saying, and I'm not sure the two ever knew that they were starting to go down the same path. But it basically conceptualizes personality, kind of as a metaphor, but kind of not as a metaphor, like a fractal reality
Yep.
of
Yes.
the personality as a type of immune system
Yes.
and
Can you
personality
say more about that?
disorder.
Because I think
Yeah,
that's a concept that Ted introduced me to that I use a lot, the personality. So say more about our personality is our psychoimmune.
yes, it's just like a psychological immune system where some of the more acute problems have an analog with acute symptoms, like I have a cough today because of an allergic process, blah blah blah. But personality disorder, when we think about personality per se and the ways it goes wrong, can be thought of as autoimmune disorder, like it's a chronic process, I guess, like my allergies,
Yeah, yeah.
that under certain contexts are going to flare up and cause me
So you're
problems.
talking about the flare up of the clinical syndromes like
Yeah,
anxiety, depression, relational disturbances, substance use. So
right. Those are the more acute expressions.
yeah,
And so personality disorder or personality more generally is basically to keep a kind of safe homeostasis for how we function, how we, believe we narrate our own lives and all that stuff. And but it's also based on identifying what is me and what is not me. I'm bridging over into Lorna Benjamin's framing of it now. Is that a lot of the parallel between a personality system and an immune system is the immune system has cells that basically recognize this is a me cell or a not me cell, and if it's a not me cell, we have
eat
to
it up.
see it as some kind of threat and neutralize it.
Yeah.
If you miscue about what is safe and what isn't, what is me and what isn't, then you can attack healthy cells. And so a personality gone wrong basically will do paradoxical things, like I get a promotion at work and now I have to sink into
Sabotage it.
and sabotage it,
Sabotage.
or yeah, or do something to pay a price as if I've done something awful.
Yes.
And if you know the backstory and history of that person, you'll understand that that response makes sense in terms of how it has come
Yes.
to be.
Yeah.
But the stability of it and the functioning of it can be thought of very much as like I'm miscuing about what is a good me and what is a not healthy maladaptive me, and then I'm attacking the healthy things while holding on to and reinforcing and staying kind of a homeostasis with unhealthy patterns. And she sees that linked up into attachment and some of
So
the Harry
that's what I
Harlow
want to get
stuff as
into it
well.
because I do want to
Yeah,
explore with you and have
but
you talk
but
about.
that interface between Ted and Lorna is like right around the personality and how it functions and
Yes.
why it functions and its
Yeah.
evolutionary roots is just I wish I had been at those
Yeah.
meetings.
We were all really into personality and from different perspectives. Me from
Mm-hmm.
more of a unified perspective, and but Ted was very unified actually in
Oh,
his.
very. Like
Yeah.
he thought across boundaries,
Yeah.
obviously.
Yeah. He was pretty much my model for and developing
Oh,
and articulating the unified theory. But
I
um,
didn't know that about you. So this is
you
good.
didn't? Yeah, no.
Mm-mm.
I have some pictures of us together at APA and SEPI out to dinner, and they were some of the high points of my career. Like just hanging out with these two brilliant
Can imagine.
minds. I mean, it was what a what an amazing experience. But that kind of gets me into wanting to have you articulate little bit more about
Hmm.
Lorna's copy process, because
Oh yeah.
I mean, in terms of what's central to interpersonal reconstructive psychotherapy, it seems like the attachment uh,
Yes.
roots are really fundamental. And so,
Yes.
can you talk to us about that a little bit to help people who are interested in learning more about?
You
Uh,
bet. Well, and when folks hear the word attachment, I've always thought of it in a very in a particular way that I'll describe, but just for those maybe listening now
you
or
mean
in the
like Thomas
future,
and Hess, avoidant, insecure, and disorganized?
yeah, there's multiple ways to talk about what do you mean when you say attachment, and I think a lot of our undergrad textbooks and certainly research literature really emphasizes the Ainsworth kind of trait-based typology, especially extended out into adulthood as sort of like romantic attachment patterns. And I don't like, there is a connection between what I'm about to say and that typology, but that's not really what I mean. I don't mean that there's broad personality styles. Like, yes, I acknowledge they exist, but this is more at the level that John Bowlby was articulating about attachment in terms of what somebody later articulated as internal working models. It's the idea that sounds a lot like object relations psychodynamic theory, that um, who we are as people is a function of being in interaction with others and then internalizing the patterns from those relationships. So we come to know self and how to be with ourselves, and we come to know others and how to be with them through this whole learning process that is enhanced and kind of amplified and prioritized through evolution with our close attachment figures. And the logic that extends beyond humans to primates and probably others is that, you know, evolution probably has some implicit story, like if, you know, we don't need to pre-program all of your genetics like we do with a plant to follow the sun and stay in one place. Our genetic code is not as pre-specified, and we're able therefore to adapt to all kind of niches and pick up different sorts of cultural tools and ways to be in the world so we can survive in all kinds of environments, including crazy fucked up wartime environments, like anything. And and the gist of it is, you get born into the world and you're a little defenseless creature, and if big creatures around you have lived long enough to bring you into it and take care of you, learn and cue from them. And so all the stuff about attachment theory and certainly Harlow's work with um, infant and mother monkeys, the implication is that um, you need your other people or your toast.
Yes, yeah.
A lone monkey is a dead monkey. Um, and it goes deeper than that, that the lessons you learn in those early relationships, especially the ones that teach you about what's safe and what isn't, and how to be in social relationships with others. So you get all your lessons about self and others and what's safe and what isn't in the context of attachment relationships. And you, whatever language you like, whether you schematize or whether you learn or whether you internalize, like whatever it is, you take that in and it becomes encoded neurobiologically and psychologically, and you make meaning of your world.
Yes, yeah.
So that when you get into later life and you're on your deathbed, you're still thinking about mom and dad and the family that's gone on before you. And maybe in some ways we all tend to, I've heard developmental psychologists talk this way. It's like a strange paradox that we all are always kind of looking at our prior generation when we probably should be focused on our rising generation coming up behind us. And the over focus on what our own history has been sometimes blinds us to what the current
Yeah,
world
yeah,
needs.
yeah.
So these ideas are all wrapped up in what Lorna calls copy process, which is a kind of a shorthand way to talk about the idea that whatever version of that story you like or dislike, there's a way to test it, and that's that it has an observable element, which is people will either repeat patterns or they won't repeat patterns. And you can see whether patterns are repeating by measuring them with this thing she developed from observing the monkeys in Harlow's lab originally, and then applying it to psychotherapy later. But originally, the SASB model was a coding system for the nonverbal primate interactions. And it turns into copy process in the sense of, if you're hearing patient narratives and the patterns that they have in their life now with themselves or with others maps onto what relationships were like early on, then there's a very precise definition. You can use this measurement system to say, oh, this is a precise copy of that in this form. And the easy one to talk
Can you give
about,
me an example? Can you give us
yeah,
an example of that?
an easy example is kind of a generic example that I think lots of different orientations will use, and it's the idea of an internal critic. The story from an attachment point of view, a developmental point of view, would go something like, I have a critical father, and now, or had as a kid, and now as an adult, I'm critical in my head, and I've so habituated to this, I've so rehearsed it and practiced it, I'm just, yeah, I believe it is my own voice, and I suck, and that's all there is to it.
Yes, yeah.
Now, you as my therapist might hear me all the different ways that I'm critical of myself,
Yes.
discover finally when I let you talk about my family of origin that
Where it comes from.
yeah, that
Yeah,
where it
yeah.
comes from.
Oh,
And
now is this similar?
sometimes you as the therapist won't at all be surprised to hear, oh yeah, you
Right.
had a dad who criticized you for exactly the same stuff. And then I will have so internalized that I'll forget where it came from.
So is it similar to what Dick Schwartz teaches and talks about in terms of like he talks about these protector parts that in order to maintain the attachment, you have this protector part that maybe has adopted the voice of that attachment figure. Like you're stupid,
Yeah.
you're not good enough, you're
Yeah.
and you as we sit with our patients, uh, we hear that very clearly. Sometimes it's egocentric for them, they don't hear it. But
Yeah.
when you point it out and you say, it sounds
Yeah.
like almost there's a different part of yourself talking now. It sounds incredibly critical. Like,
Right.
who is that that's talking? And then they say, oh, yeah, that's my whatever. Is that what
Yeah.
you're sort of,
Yes. Yes.
yeah,
It's not an idea that's unique to Lorna's thinking. And actually, Lorna had a fair amount of humility about saying she's not inventing a new therapy. It's about pulling together existing wisdom and trying to make it testable and teachable and practical in some ways. But this idea that we have a family in the head, and it's not just some kind of Jungian archetype. Like we have
right,
our
right,
actual
right.
family, and we actually still have them in our head right
Yeah.
now.
So what do you think about, so here's the way that I try to capture that and use that with the patients that I'm working with. I talk about you as having hardware, your brain, the integrity of your central nervous system. You got a
Mhm.
good, I can tell you got a good central nervous system. However, I think your software is really antiquated. And what I mean by your software is the beliefs, and I think it's similar to what you're talking about, the beliefs that you
Mhm.
internalize, Ken, about yourself from your experiences are still stuck like your iPhone has not been upgraded
Yeah.
like it's regularly done. You're still stuck in I'm not good enough. You're stupid. You're not safe. And so
Right.
I try to break it down to, and some people do have hardware problems. I got a guy right now
Yes.
who's
Yes.
got major brain dysfunction. His hardware's so it's a different approach. Yeah,
Substance abuse also
exactly.
prevents software updates.
Yeah, because there's a lot of brain damage with that. So
Yes.
the hardware can, if it's got integrity, then I'll say to the person, we're really looking at how
Yeah.
you can upgrade your software.
Yeah. And
A lot
I
of
think
people
that's a
think they
piece of
get
it.
that.
That's a piece of it. I think where Lorna's theory comes in and has more power and utility is when someone gets that already, or they can, and they've tried to work on it, and this system is not upgraded.
Yeah. So how do we
Or
upgrade?
they get it cognitively, but they're still engaging in exactly the same patterns
Yeah, okay,
in
so
lived
so then the
experience.
question, which I think everybody wants to hear about, we know what we can, we're really good at sort of identifying the
Yeah.
software, the
Yeah.
internalized beliefs. We know that from all the cognitive stuff and
Yep.
all the, then what do we do? How do you
Well,
upgrade that software?
here's the relational turn that I see in Lorna's work that relates directly to this, which is that when I am repeating my overlearned criticism of myself that I learned with my father, you can talk with me about and maybe make some progress with me about questioning the basis of that, doing rational disputation, helping me sit and mindfully tolerate that
More
and
cognitive
let it
stuff.
pass. Like there's all kinds of stuff we can do.
Yep.
But there's something important there is that if I will probably be missing something if I only talk about the content of those thoughts. The other way of looking at it is that I'm staying close to my dad when I do that. I'm bringing him close. I'm being with him. I am communing. I am in communion with my loved one.
Oh,
However problematic that attachment was with the patterns we learned, whatever I am, I'm close to them when I
why
do that.
would we want to be in communion with someone that put us down or hurt us?
Well, I can tell you the story about that with my own loved ones and family members. Like even the abused kid doesn't want to be pulled away from mom and dad's arms. They don't
So
want
you're
to keep
saying
being
that it's
abused, but they don't want to go away
it's to
either.
maintain the
You
attachment,
maintain
which
the
is
connection.
critical to our survival developmentally.
Exactly. This and it's not just that there's some like there is a critical early phase of creating these attachment bonds and so on. It's not so critical that we can't continue to make new attachments across our life, including with therapists. But there's something about the early learning that sticks, and it is hard to let go of the yearning to finally be accepted by or learn or show loyalty and be valued inside of in the eyes of those loved ones. And so this is what Lorna
So
uses.
I
Yeah.
sometimes call that, sometimes I tell my patients, it sounds like you have pathological hope that someday you'll get what you
Uh,
need from your attachment figure.
and this is what Lorna, or a piece of it anyway, is what Lorna refers to as the gift of love.
The gift
It's,
of love, yeah.
it's that what our field calls psychopathology is actually in some coded way, or maybe not even very coded way, an attempt to do something that will be designed to finally get some kind of love, acceptance, recognition, protection, even from mom and dad or my ex-lover or
Can you give us
whoever
like
it
a
is.
clinical example of that from your experience?
Yeah, well, I mean, and for those of you who want to know more, like there's some case examples published now. It's some of which I really like, some of which are heroic endings where it's great outcomes, others that kind of fall apart, but you see the story.
Okay.
And most of them, because of the folks we worked with in the clinic with Lorna, where we would be referred, like the stuck cases, the complex trauma cases, the stories were kind of horrendous and kind of complicated. And the SASB model with its ability to track patterns, and I haven't even told you the varieties of copy process yet, but it was a way to help patients, well, first understand their patterns, but also in a collaborative way, help them see their own patterns, how they were repeating whatever it is. And then with the clarity of that joint awareness, work on the question of, well, why, what choices might you make about changing these patterns? And I'll get into some example here pretty quick, but also the question of what keeps you stuck in this pattern, what makes it hard to change. There's a fair amount of essentially motivational interviewing that comes in about the question of, do you want to continue doing it? Do you want to continue seeking love by showing loyalty to these old ways inside of an attachment system? Or do you want to try and explore something else that might be better adaptive in the world? The pressure to keep repeating the old ways is the gift of love, and it's the call of attachment. Basically, it's attachment gone wrong.
Is that to avoid the grief and the loss of the idealized relationship?
Exactly. Um, well, yeah, I don't know how aware everyone is at the outset that grief is ahead down that path of differentiating, but it is for many.
So do you feel like in order to restructure the copy process that you have to go through a process of grieving the attachment that was harmful or
Typically,
deficient?
yeah, it is. It can be a stormy change process, and it requires someone to want the change and to understand why they would want to or need to let go of the hopes that have been fueling them. So I don't know which of the people who come to mind should I tell you about. I mean, I think a relatively common, not too like exotic sort of story would be folks I work with, where the general pattern is that they have experienced a fair amount of control and intrusive control growing up, like maybe a family that has a lot of rules and order and emphasis on perfection and looking a certain way and being a certain way. And it's maybe dad or mom has it in mind that all the kids have to behave a certain way to be good.
So it's like kind of like maybe a narcissistic type of family theme.
Uh, Maybe, but it's interpersonal control. And in the story that I'm making up, there is an element of for appearances. So that would be the narcissistic part. But you can get control in in other ways, maybe a religious community's version of control, maybe a military family's version of discipline. We've got different cultural prototypes that might lead to these patterns. And the nice thing about the SASB model is it just says, okay, well, what's the pattern? So if the pattern the kid is exposed to is a lot of control, and you need to submit, or else you'll get roundly punished, blasted, or threatened with the same, so that you're fearful, so you need to comply or be in terror. And that person grows up, and if they are, the thing that brings them to therapy will usually be something like, I'm anxious all the time, or I feel I can never be enough no matter how hard I try. And so if the tip of the iceberg you get is, I'm anxious and I feel I'm never enough, a lot of our CBT and other types of techniques can help with that to a degree. Like, folks can meditate and read their books and podcasts and feel better. But if it doesn't change readily and easily just by saying, oh, I have a certain pattern, I want to change it, I'll change it. If it gets sticky, there's usually a backstory holding it in place. And so in the example I gave you, you would eventually discover, like, oh, the whole development is characterized by this.
Mm-hmm.
So now I have a new thought that I can bring into the therapy, which is, when you're anxious, when you are feeling like you're unable to be enough, let's look at how much of that is reality based and how much isn't. But let's also talk about how your father seems to be in the room here with us now while you're having this experience. Can we kind of turn and talk to him? Now, IRT is this very eclectic, like, there's a set of concepts, but then you can just choose whatever techniques you want. And so at this moment, we might say, well, can we grab some EFT two-chair techniques and see if we can talk to that dad? And can we engage in a dialogue that has the goal of helping my client get some perspective, feel a little separateness from it, so that the using your metaphor, the software has a chance to update. But the part of the self that wants to please that dad and finally get accepted by him and not be terrorized is ambivalent about that whole project. And so when you're working, especially with personality disorder, but I think everyone really, you have at least two people in the room with you, and one is actually is wrapped up in the family narrative about how this is an important quest that they're engaged in and a yearning that needs to be addressed, versus the part that says, oh, I can see how that pattern's not working, and I can see that I probably need to let this go, and that's going to hurt. Grief will be there. So that prototype I've just described, I've seen fair enough, often enough, that I think others will recognize the
makes
general
sense.
outline of that.
So just to kind of divert a little bit,
Mhm.
it sounds like a lot of what Lorna was talking about, it resonates a lot with Leary's interpersonal theory.
Oh, absolutely. Yeah. Well, I'm not sure what I offered that pinged you for that, but I know another route to the Leary story through the structure of the interpersonal measure in the first place. But let's see. Yeah, everybody read my book. In the book, I basically say, here's all the great ideas
So
Lorna
can you
ever
just
had.
say the name of the book?
Yes, it's called The Structural Analysis of Social Behavior, SASB in parentheses, a primer for clinicians.
Right.
So this is a method that's had a lot of research application, but it's always really been intended for clinical use. And so this is speaking to our audience as clinicians here.
Yes.
And there's a first chapter where I acknowledge to some degree that if we're good at our craft, we already kind of know this in our gut. We have an intuition and we can sense when patterns are repeating and the attachment figure is here, and we can talk about it somehow. Especially those of us who've had a training that's emphasized that perspective. But it's always there and it's accessible. And once you start noticing it, it's always there. Now, what SASB does is it provides a method for specifying patterns and making them a little bit more concrete and abstracted out of their contexts, so that you can see when they're repeating across different contexts.
So is that what you mean by copy process?
In part, yes. Let me describe the SASB model first, and then I'll describe the types of copy process. So that the SASB model is Some folks say that this is complicated and sophisticated and nuanced, and other words that mean complicated, but it isn't. Like, what's complicated is what humans do inside of our life space. The model itself just has 3 dimensions, and we can do all kinds of fancy stuff in 3 dimensions. Um, the first dimension is called focus, and so some behaviors are directed by the person behaving out towards others, and some are uh, kind of intransitively responding or reactive to others. So there's focus on self and there's focus on others is a major distinction. There is a third focus called introject, which is not about the interpersonal space. It's just how I treat myself. So the first distinction is
Isn't that
focus.
based on the I mean, that derives from the interpersonal. The introject is the
Oh yeah, the Sullivan's language.
absorption of the interpersonal, right?
Yeah, that's right. Well, the theory is
That's the software, right?
we come to treat ourselves the way we've been treated.
Yes, okay.
In terms of this measurement system, it's just like, okay, behaviorally, it's whatever you do to yourself. The second dimension is how friendly versus hostile this interaction, this moment is. And the third dimension is how interdependent versus independent this behavior is. How much am I co-coordinated with you versus doing my own thing, or allowing you to do your own thing versus like trying to manage you. And Lorna puts it kind of simply in primate terms, like 2 monkeys meet in the woods and they need to figure out 3 things really quickly. The first is, who is this about?
Are you
And
safe?
are we in friendly or hostile space? And is this about us or are we separate? And her idea is that we rather rapidly are designed with our brains to just kind of navigate in these 3 dimensions already. Is this about you or me? Are we friendly, hostile? Or are we together? Are we different? And I think most of us cue to the friendly versus hostile as the most salient in a lot of contexts. But the thing about who are we talking about right now can pose confusions. In therapy, usually it's the therapist focused on the patient focuses on themselves. So there's a peculiar asymmetry to that relationship. But most of the time we're out in the wild, there's a certain amount of this is us and we're reciprocally focused on one another. So you can use these 3 dimensions to if you want to be picky with research, like take sentence by sentence and pull apart what people are doing with each other over time. There's some fascinating psychotherapy process research about patterns of complementarity and back and forth. But the copy process thing, you're able to identify and name patterns within this structure and see what resonates when it's repeated across time or across contexts or relationships. And there's 3 main different ways that it repeats. So these are the copy processes. Okay. And one of them is called identification, which means the thing someone else used to do, I now do it. So if my dad was
to myself or to others?
To others.
That's the way my dad treated me, I treat others.
Yeah. So he was critical of me. Now I grow up. Now I'm critical of other people.
Okay.
I've identified with that.
Yeah, I can see that.
It's kind of close to psychological defense mechanism language, but it takes a very behavioral turn with it to say, like, here's the observable piece of this, and we'll call it identification, because then that becomes kind of a conversation starter for someone to notice, oh, why am I being like so-and-so? And do I want to be like so-and-so? And it can be healthy stuff too. Like, oh, my mom is a really loving, giving, warm person with all comers, and I am the same way. So like when attachment works and copy process works well, it's actually supposed to support healthy adaptation and normal social functioning. But it can also go wrong, and what we learn and internalize is we're being loyal to the wrong messages, or they're maladaptive in our current context. So that's identification, is being like the other person in relation with others. The thing you asked about is called introjection, which is I was treated a certain way and now I treat myself that way. So my dad was critical of me, now I'm critical of myself. That's introjection. And then the third flavor is called recapitulation, which is basically being stuck in the same place in a new role, in a new relationship that you were back in the other relationship. So if I've got that critical dad, and now I'm in new relationships and I'm always on the receiving end of somebody's criticism, then I've recapitulated that relationship. I'm still in the same role I was in. I've attracted another criticizer into my life. Or maybe I haven't maybe it's a perfectly nice person, but I'm always cringing as if they're about to. We've got some New York sirens coming outside. You
Yeah,
hear
there's a
those?
lot of activity going on around there.
There's a hospital down the block from where we are.
What hospital?
Uh, what's the Jacobi Hospital? It's the Einstein Medical College. It's like all the stuff up here in the Northeast Bronx. Um, so there's identification, introjection, and then recapitulation. Recapitulation, a prototype would kind of be like I'm a victim of domestic violence. And I finally get out of that relationship. I get into another relationship. I'm being abused again. And it doesn't need to be a blaming the victim kind of thing. It's sort of like just this uncanny repetition through whatever means.
So we also call that reenactment.
Reenactment works fine. Recapitulation has a specific meaning in SASB terms for like what domains do you expect the coded version to show up in.
But how is that different from the introject? If I interject, if my software is an interjection of I'm undeserving and I'm bad, I should be punished.
Yeah,
How is that? Isn't the recapitulation the enactment of the internalization?
they can coexist, and they often do. So the interjection piece would be me beating up on myself internally, telling me I deserve whatever. The recapitulation would be the
Getting someone else to beat up on me?
getting someone else to do that, or fearing that somebody who's not going to do it will. Like it's definitely about me and that other person. It's not just me with myself. And there's processes of projective identification, things like this, where you can use expectations about what you think you're worthy of to shape the behavior of the other person over time through complementarity and all these other interpersonal processes. And the SASB model and copy process theory allows you to track and name and have language for these things. And the language is simple enough that it can be described with patients. I'll even sometimes bring a picture of the model itself into sessions and help patients like map their own relationship patterns into it and make decisions about what they would rather give as a response to whatever's going on.
Mm-hmm, mm-hmm.
So
So
it's a set of very useful tools.
So the three copy processes are interjection,
Mm-hmm.
recapitulation, and
being like identification.
identification. Okay.
Yeah. And there's all kinds of fancy things you can do in research with how to verify that a lot of clinical wisdom about pattern repetition and copying and these things, like establishing that it is a thing, figuring out how often it happens, answering questions like, do boys tend to copy their dads and girls copy their moms, or vice versa, or what are the contexts? We're doing some research now, or I'm excited about having my head in a database of trying to answer questions like that. And part of the reason I'm in that world is I'm trying to figure out if we as humans are screwed or not. Um, as I'm thinking about our current politics in the US here, and finding myself surprised at how many people are kind of happy with dominance and control, as opposed to empathy and compassion and vulnerability being kind of ethics for healthy human beings.
Well, it gets us back to the classic stuff on the authoritarian personality and how many people really want a strong daddy figure.
Yeah. Well, but there's also the question, I think, of how many folks want to continue with a maladaptive gift of love across generations. The idea that I want a strong daddy figure.
Because
the definition of strong in there is like, are they going to be dominant and neglectful?
Right. So does interpersonal reconstructive theory, does it have a concept of multi-generational transmission of trauma?
Well, absolutely. Like that's essentially what copy process is about, except it casts a little bit of a wider net to capture patterns that aren't necessarily going to be called trauma in most people's lives. Maybe it was something that seems less benign, but has the same stickiness across generations. So copy process as an attachment story is basically I was treated a certain way by my loved ones, and now I grow up and I reenact the same patterns with my next generation. And there's some SASB-based research that establishes that that is a thing that is very common, both in its healthy forms and in its problematic forms. When there's problematic patterns that have been informed or shaped by trauma, those also get passed on to the next generation. So my concern is like, well, which pattern tends to win out? If we can play out humanity in the long run, are we going to go for the healthy patterns in the long run or the unhealthy patterns?
Well, so Lorna Benjamin was an amazing scientist.
Mhm.
When I listened to her, some of her lectures that I had the privilege to be in the audience for, I was struck by her transdisciplinary knowledge of science and the integrative nature of her thinking. And I was wondering, what do you think she would say about the research that has been coming out now about the epigenetic transmission of
Oh,
like the work of
she
Shota?
loved it. She
Can you
loved it.
say a little bit about like how you think interpersonal reconstructive psychotherapy would would weave the epigenetic transmission of trauma?
Mhm.
Because I've worked with
Oh,
people
yeah.
from Holocaust and from uh, other kinds of severe uh, multi-generational trauma, and I think it's so powerful and under-recognized.
Oh, yeah.
What's your thought, or what would Lorna say about that?
Um, well, something profound, something profound about epigenetics is the whole idea that things can happen to you in the life and in the psychosocial realm, and it will encode itself into the biological world
Yeah, yeah,
in a way that can be and is transmitted to a new generation without them having experienced the same trauma or being shaped by it. But typically, that kid growing up with these genetics, and it's not like completely different genes, it's just what's turned on and what's turned off as a function of experiences that are encoded.
yeah.
But they are typically also raised by the person who gave them those genes, along with passing along the meaning that they have made of their own trauma, whether stated or unstated, the
Yeah.
behavioral patterns that have been shaped by it, the cultural context in which it happened.
Mhm,
So,
mhm.
so I will not only get the jumpiness that would come from my genetics, but I get the narrative about the scary world in which
Yeah, and the anxious people.
yeah,
I hear
and
that sometimes. We're all we're all anxious people. My mom and dad were anxious. I'm anxious. I
yeah,
think it's genetic, and yeah, there's something
and
to that.
and
But
sometimes families will tell you the trauma history, and sometimes it's the family secret, and you only
yes,
discover like, oh, now like I wish I had been told that in my teens, so that when I was in my 20s and 30s, I would know why I keep reacting this way. But
yeah,
but so some of it is about true like attachment as meaning and behavioral practice and shaping, but that is interleaved with epigenetic processes and
mm,
genetic inheritance and the way even a parent responds to a kid. Some of this explains why, well, the stimulus quality of this kid is the one who reminds me of my dad who was my
yes, yeah,
this
yeah. That
kid reminds me of my mother who was a saint, so I treat them differently because I'm implicitly reacting to them differently.
yeah, that is really important. So we have a minute left.
Oh, this went
What
so
would you this went so fast. This has been such a great
I've
conversation.
really enjoyed it. Yes.
What would you say to early career psychotherapists? What would you tell them about?
Oh,
Give them some wisdom about people that are just getting into this field, and anything you want to tell them.
wow, that's a big question.
I know, and you got a minute.
Yeah, I mean, I think the most important thing is, well, geez, I had a patient I worked with for many years, one of the people I consider close to my heart, my secret family of clients. You know how we all have our secret families. I would ask her whenever I went to a conference, I said, what message should I carry to the community of psychologists? Thinking she will offer some deeply philosophical, profound thought or something that will inform my research. And it was heartbreaking with the clarity, and it is played out with others as well. The message always was just tell them to listen.
Oh my God, that's so interesting. We interviewed Laura Brown
Hmm.
previously, and
Hmm.
I was just telling a colleague about this on the phone today. One of the things that she said that has stuck with me is listen as if your life depended upon it.
Yes, and it's the most simple thing, but the most powerful. And the heartbreaking piece, it is the biggest critique of our clients of us, is that I
Yes.
think we get too wrapped up in our big ideas.
I agree with that.
Yeah.
Wow. So thank you, Ken. This has been a wonderful discussion. I hope you can come back and you can tell us more about your work and yourself.
Oh, would love
But
to.
thank you so much for joining us in Psychotherapist Face to Face. And this will be up for people to watch shortly. And we're going to hang around a couple of minutes after we stop recording for people who want to ask, have any questions that they want to ask. Thank you all for attending and hope you come back next month. Next month, I'm going to do a master class on preverbal trauma. So hope you can
Mm.
join us for that. Thank you all for attending.